Good morning once again. Newzroom Africa's focus today is on healthcare workers as we honor those on the front lines and who are exposed to the deadly coronavirus every single day. Now, the second wave has devastated the country, causing daily infections to rise and placing thousands in need of critical care. And many thousands of people have been working hard to keep South Africa's overstretched healthcare system from collapse. While it is those healthcare professionals who are first in line for the COVID-19 vaccine, there is no getting away from the hard truth that many in the sector have already died. They have paid the ultimate price in their quest to care for the sick. And today, we ask, how ready are we for the rollout of the vaccine for our healthcare workers who continue to work in a sector impacted so heavily by COVID-19. We've got a discussion happening for you just now. Dr. Angelique Coetzee is the chairperson of the SA Medical Association, and Cassim Lekhoathi is the acting general secretary of the Democratic Nursing Organization of South Africa, DENOSA. They're both with us this morning to talk more about this issue. To both our guests, good morning. Thanks very much for your time this morning on the AM report. Cassim, I want to begin with you this morning as we try to count the cost of the mental impact and the physical impact that the COVID-19 pandemic has had on the people who have had to wage this war on the front lines, and those are our healthcare workers. Where do we even begin?
Thanks for hosting us, and good morning to your viewers. Yes, indeed. I appreciate what you said, that as nurses, we had the brunt of the worst side of this COVID, where we have to sacrifice our lives in order to save the population of South Africa. And I must stress that as nurses, there's very or no support psychologically that is being done to encourage us to carry on to do the best that we have committed ourselves when we took our pledge. And I want to believe the government, the Department of Health, will have to come on board to give us that support in order to see a successful rollout. Even to suggest you are going to roll out this without bringing healthcare workers and nurses in particular on board, you are on the way to a failure, and it becomes disastrous. It is a given that there's a lot of misperceptions going on, and what we want to emphasize as DENOSA, education, information is the order of the day. Without it, we are going to fail. I want to just go slightly back. The success of the rollout of HIV and ARVs. We saw a lot of our people demising. Till such time, the government came to its senses to engage and involve nurses for the rollout of the ARVs. And we saw success stories in that regard. That process was called NIMAN, Nurse-Initiated Treatment. If you don't do that with this, and all what the nurses are asking is, bring us on board. We need to know about this vaccine. Give us education. Time is running out. So we are still expecting and waiting for the department to roll out education, information, so that we are going to be the ones who are going to meet with the communities out there. And we cannot meet them without full information for the effective rollout of the vaccine.
Dr. Angelique Coetzee, I want to bring you in here. I mean, that is a devastating thing to say, that nurses have not been brought on board as yet, just a few days away from 1 million vaccines arriving in the country, that nurses are, according to what Cassim is saying, that they've yet to receive any training, they've yet to be brought on board. As the SA Medical Association, what do you know about the steps that have been taken in terms of the vaccination rollout?
Good morning, and good morning to all your viewers out there. From SAMA's side, we are in a bit better position than DENOSA, as we are part of Business from South Africa, and we also sit on some of the MAC committees of vaccines. And it is true what Cassim is saying. You know, I just realized now that even on Business for South Africa, there's a lack of engagement from the nursing side, you know, except if they are thrown under HASA. But sometimes I get the feeling that there, you know, it's like a sick patient sitting in front of you and the mother sits next to the patient, and you actually speak the whole time to the mother instead of speaking to the patient himself. And this is my sense of feeling I get when I look at the nurses and also the private practitioners, although we are in a bit better position. I'm also very much afraid that we might see a rollout starting, but the key questions, the things that's important to us on ground level, those questions are really not addressed in the way it should be. We have these overall plans, and the plan gives us as guidance to say, okay, from National Department of Health, it goes to provinces, from provinces it goes to the various hospitals and pharmaceutical or pharmacies. And then you will sign a consent form, and you will be vaccinated, and then afterwards you will, if you've got any side effects, you will be able to give those side effects either via an app or hopefully a hard copy. And that's it. So you then expect us to answer the questions of the patients. There's still a lot of questions regarding the vaccines. That's not really answered. It's brushed over. And maybe people think that those questions is going to go away.
Angelique, what are those kinds of questions that you're talking about? Is it regarding the efficacy of the vaccine, the safety of the vaccine? Are those questions that even nurses are still asking?
Well, yes. Can you tell me at this stage whether if I get the vaccine, and please don't get me wrong, I'm not against that, but this is questions that comes up. If I get the vaccine, I know that not if I get COVID-19, the disease, it would not be as bad as it would have if I haven't got the vaccine. But would I still be able to be contagious to other people? Can I still give the virus to others? Can I spread the virus? What do I have? Do I have a choice as a nurse or a doctor if I do not want the Pfizer vaccine, the AstraZeneca vaccine, to wait for the next one that might be better? Do I have a choice? What do I say if I don't want to take the vaccine because of various other reasons, and I'm employed at the public sector? Would I then lose my job? Because ethically, if I don't take the vaccine, I might be seen as, that's my human right, but I might be seen that it's the other patients or the other people that I'm serving's human right as well to be protected. So what do I do? Am I then forced to take the vaccine, otherwise lose my job? These are questions I think that's important that we need to understand. Would there be a resuscitation center or a team that if I get the vaccine and there's an adverse reaction on site, that someone can at least jump in and help me? What about those type of things? So there's a lot of practical questions that I think that still needs to be answered. The other thing is, if I get vaccinated, will I be able, how long is it going to take? I know that we're not sure, about 6 or 9 months for the immune system. But is it clear that I maybe then get another vaccine for another variant? How does it going to work?
Yeah, big questions there, absolutely. Cassim, do you have, as DENOSA, any clarity on issues like, whether healthcare workers have a choice of not wanting to take the first round of vaccines being delivered to the country, that's the AstraZeneca vaccine, and perhaps wanting to wait for the next vaccine. Do you have any clarity on some of the questions that Dr. Coetzee has just raised?
Well, we have been given that assurance that no one will be forced to take the vaccine. And I want to believe that is on record. And so surely our members should not be scared that they'll be acting criminally for refusing to accept the vaccine. However, everybody is concerned about the rate at which people are dying. And naturally, nurses are not immune to that type of feeling. So they also want to save themselves, their loved ones, and their patients, because their only purpose is for the care of the patients. So the emphasis of information in respect of the vaccine will have to be done as a matter of utmost urgency. There's a ticking bomb. Time is running out. Today is the 28th of January. And we are still hoping that the rollout will happen not on national television, because nurses don't have the luxury to be watching the rollout and the explanation thereof. It has to go down to the ground, into the provinces, into the districts, where it is going to be administered. And I'm saying that it will be, there's a requirement, an expectation that the rollout will include, among others, the nurses to roll out this vaccine. So they have to be brought on board. And as Dr. Coetzee have said, you're sitting there with the patient and the mother, and you need to give information. We need to instill confidence in the people. Now, if you are clueless, then you are a disaster, literally. And I don't want nurses to be set up for failure. No, we don't encourage that, and we will not support that. We are calling still that they must come on board as a matter of utmost urgency to address these issues. All these issues Dr. Coetzee is raising, there's a lot of questions. Among others is the issue of the efficacy. The issue of why did we run to produce this vaccine as if it was correct for patients with HIV and AIDS to pass on? Why could it not get the vaccine run about that period of time? Those are the questions people are asking. And please, for crying out loud, do not reduce them to fake news or negative publicity. Answer these questions so that nurses can get clarity, and then we can save the population of South Africa.
Yeah, still plenty of clarity needed on various issues, particularly as they relate to the vaccine and as they relate to the healthcare sector as well. To both our guests, unfortunately, that's all the time we have for this interview this morning. Dr. Angelique Coetzee is from the South African Medical Association. She's the board chairperson, in fact, and Cassim Lekhoathi is DENOSA's acting general secretary.